Hello, my name is Ben Olson. I'm going to be your PA taking care of you today. Can you go ahead and verify your name and date of birth for me?
Brandon Olson, February 28th, 1990.
All right. So let me just wash my hands. So it's my understanding that Jessica Halford did a cardio exam on you and listened to your heart and stuff. Is that right? Okay. I'm going to continue your exam. I'm going to listen to your lungs, and then I'm going to listen to your aorta and your stomach for different abnormalities if there are any present. And then I'm going to inspect your arms and legs, noting any color changes, pigmentation, and ulcers, scars, and then look at your legs and address that as well. Is that okay with you?
Yep.
Okay. First off, I'd like to go ahead and listen to your lungs. So if you can go ahead and take some deep breaths for me. And out. Okay. And out. And again. And one more time. Okay. Everything sounds good there. Lungs are cleared to auscultation bilaterally. Did you experience any shortness of breath or lightheadedness during that? No? Okay. Next, I want to go ahead and have you stand up, and I'm going to inspect your arms and your legs. So if you can stand up for me. I am inspecting the fingers, in between the fingers. I'm inspecting the palms, checking the capillary reflex, which is intact, noting the temperature throughout the right upper extremity is consistent. I am checking for the radial pulse, which is 2 plus, and the ulnar pulse, which is also 2 plus, noting that the arms are symmetric, no signs of swelling or edema, no ulceration, scars, or pigmentation changes. I'm going to inspect this hand in between the fingers, looking at the nail beds, the palms, checking the capillary refill in the left upper extremity, which is 2 plus and intact. I'm going to palpate the radial artery and the ulnar artery, which are both 2 plus and intact, which is normal. And then I'm going to check the brachial artery, which is good. And then I'll go ahead and check this one. Also good. Now I'm going to go ahead and check the epitrochlear nodes right here on the medial aspect between the bicep and tricep. Not palpable, which is normal. And check this side. Not feeling any. That's good. Did you have any tenderness with any of that? Okay. Next, I'm going to perform the Allen test. I can have you sit down and we can do this. So what I want you to do is squeeze your hand rapidly and then hold. Then I'm going to occlude the ulnar and radial arteries, and then release your hand. And then I'm going to release the radial artery. It should flush back. Good. That's intact. And go ahead and have you do it again. And repeat on the other side for the ulnar artery. Looks good. This is just testing for competency between the radial and ulnar arteries. Okay. Release. And then one more time. And release. Good. I would also, if I had the equipment, like to take blood pressures on both arms and also do an ankle brachial index, but we do not have a Doppler ultrasound. Next, I would like to palpate the aorta, so I'm going to have you lay flat for me. Okay. So what, have you had any tenderness or pain, discomfort in your stomach? No? What I'm going to do is I'm going to palpate for your aorta, and then I'm going to measure the diameter. It's approximately 2 centimeters, which is normal. Do you have any discomfort with that? No? The aorta is palpable. I'm going to listen for any bruits. Everything sounds good there. Now I'm going to listen to the renal arteries, the iliac arteries, and I'm going to make my way down to the femoral, and then I'll assess the popliteal artery, as well as the dorsalis pedis and the posterior tibialis on both legs. Alright, all sounds good. No signs of any thrills. I'm going to put on some gloves. If I could ask you to pull your shorts down a little bit in your boxers so that I can access your groin. Alright. Have you had any pain in your hips or your legs? No? What I'm going to do here is I'm going to palpate for your femoral artery. I'm also going to palpate a little medial. You have any pain in this area? No? No tenderness? I'm going to switch to the other side. Alright, 2+ bilateral. I'm going to go ahead and listen. Everything sounds good there. No signs of any bruits. I'm going to go ahead and palpate the inguinal lymph nodes, the horizontal and the vertical. Looking for any tenderness or swelling in those nodes. Do you have any pain in this area?
No.
I'm going to check the other side. Any pain there? No? Okay, both the right and left side inguinal nodes are palpable, but within normal limits, approximately 1 to 2 centimeters. And then I would like to continue, no signs of pain or lymphadenopathy with that. I'm going to continue down the legs, noting any temperature differences between the two. All the way down to the bottom, the soles. Okay, I'm just going to feel. Let me know if you have any pain. All the way down. Any pain with that?
No.
Okay, I already inspected for any rashes, scars, pigmentation changes, ulcers, and stuff of that nature. So now I'd like to palpate for the popliteal artery. What I'd like you to do is just, let me bear the weight for you. Okay, and this one. Okay, good, they're intact. And I'm going to check for the dorsalis pedis. I don't know if you can see this. Here. Good. And then the posterior tibialis. Good. 2+ bilateral pulses to the femoral, popliteal, dorsalis pedis, and posterior tibialis. Next, I'm going to assess for edema. It doesn't appear to be any asymmetric swelling or swelling bilaterally. I'm going to check the dorsalis pedis first with my thumb. Pressing in for 2 seconds, releasing. No pitting noted there. I'm going to check the posterior. No. No. And then I'm going to go ahead and check on the shins. Draw a common sites. All good there. If I could have you slide back a little bit further, I want to assess your calves. So I'd like you to bring this leg up like this. I'm going to palpate the calf, looking for any cords or tenderness throughout the calf. That feel fine?
Yep.
And I'll do the other side. Here. Good. Any pain there?
Nope.
No signs of any varicose veins or anything of that nature. I'm going to go ahead and assess the arterial insufficiency by doing the Berger's test. And what I'm going to do is we're going to lift both legs to as close as we can to 90 degrees for 2 minutes. But for the sake of this video, we'll do it for a minute or so. And then I'd like you to swing both your legs to the side. And I want to assess if there's any differences in the speed at which the blood reaches the right versus the left, and if there is any difference there. Should take about 10 seconds to see pinkness, and then 15 to see the veins refill. Okay, go ahead and lift your legs up here. You have any discomfort with this?
Nope.
Okay, you can start to see the color from the feet turning more pale as the blood leaves the legs. And we're going to have you swing over. You can sit down. I'm assessing for speed at which the blood returns to the feet. All appears normal. Good. I'm also assessing for any hair changes on the arms of the legs, fingers, toes. It all appears normal. Have you noticed any recent hair loss or patches? No? Okay, that's good. And then I just want to take a look at your toes and in between your toes. I don't know if I already did this or not. Just looking for any cuts or pigmentation changes on the feet, any ulcers on the bottom. Any pigmentation changes here? All looks good there. I'll test capillary refill. Good. And good. All right, the capillary refill is intact in bilateral low extremities. I believe that is it. Do you have any questions for me today? No? Okay. That concludes my examination.